A concussion is a mild traumatic brain injury caused by a bump, blow, or jolt to the head or body that causes the head to move rapidly back and forth. Colorado Concussion Clinic is committed to reducing the long-term health impact of concussion by providing innovative care.
A concussion is a mild traumatic brain injury. You actually don't need to lose consciousness for a concussion, and you don't need to hit your head. You can have a direct head impact, but you can also suffer from an acceleration-deceleration injury, think whiplash. So when we get a concussion, it actually makes the brain stretch. That causes a few changes. First, inflammation. This can actually change over the first 72 hours. It's called an evolution of inflammation. Then we can also see neurochemical changes that will give you the symptoms that you think of when you think of concussion. So that's nausea, dizziness, balance changes, headaches, and of course, that brain fog. We also see an energy change with concussion. When the brain is under repair, it needs a lot of energy to help with that repair. But at the same time, it can also be difficult to get that energy restored. Here are the top things I want the community at large to know about concussion. First, know how to recognize concussion. If you think you had a head impact or you think you got your bell rung, it is very important to stop playing. I also want people to know that it's very important to rest for the first 3 days. It is also important, especially if you're not sure if you had a concussion, to go see someone experienced in evaluating concussion. With concussion, it is hard to predict who is going to get better on their own and who is not. We know that about 30% of people will not get better on their own. The sooner you're seen by an experienced clinician, the faster you will recover. At the Colorado Concussion Clinic, we have a multidisciplinary team to help you with all the different symptoms that come along with a brain injury. We know that Colorado is active. You're out there hiking up the mountains, skiing down those mountains. If you're worried that you had a concussion over the weekend, please give us a call as early as you can, and we will try to get you in for quick evaluation so we can get you started on your individualized plan as soon as possible. Here at the Colorado Concussion Clinic, we use gold standard evidence-based medicine to help treat your concussion. We have a team that includes multiple different disciplinaries, such as neurooptometry and vision therapy, PT with vestibular therapy specifically, cognitive therapy run by our speech-language pathologist, and mental health therapy as well.
If you have sustained or may have sustained a concussive injury in the past 6 months and are continuing to experience cognitive impairment and/or physical symptoms like dizziness, light and noise sensitivity, headaches, and sleep issues, contact Colorado Concussion Clinic to set up an initial evaluation.